Good morning and welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe my channel and also please give your valuable comments. Now we were discussing about common cardiovascular problems, congenital cardiac problems in children, and we have already completed 3 classes for this. Now this is the 4th class. In this class we will discuss about some of the different classification of the cardiac problems, congenital cardiac problems. Congenital cardiac disorders are basically divided into 3 basic groups. Number 1 is structural, and another one is positional, and another one is functional. Now structural means there is a problem in the structures. Okay, the structure is incomplete, structure is abnormal, etc. So they are again divided into cyanotic and as well as acyanotic structural congenital cardiac problems. Again, these structural problems are divided into cyanotic and acyanotic. Then cyanotic and acyanotic, each one is again divided into 3 types. Structural cyanotic with the pulmonary blood flow increased, decreased or normal. Similarly, structural acyanotic with the pulmonary blood flow increased, decreased or normal. And structural cyanotic with the dominant ventricular right or left, and structural acyanotic with the dominant ventricular right or left, and structural cyanotic with pulmonary hypertension present or absence, structural acyanotic with the pulmonary hypertension present or absence. Actually, these are the detailed division clinically. This is a detailed division of a congenital cardiac disorders. Another is positional. In the positional, commonly we will have disorders like dextrocardia, etc. The positional defect is there. And another is a functional. There is no problem in the position, there is no problem in the structure, only function of the heart is get affected as it occurs in case of congenital arrhythmias. There are different types of congenital arrhythmias. So like this, the congenital cardiac disorders are basically divided into main 3 types with some of the subtypes. The cyanotic congenital heart disease. So let us discuss first. This is one of the structural problem. Okay, in 1925, Ostlers gives the 4 methods of diagnosis, that is inspection, palpation, auscultation, and contemplation. And I think everybody knows about NADA's criteria. Okay, so NADA's criteria is most commonly used to identify the cardiovascular problems. The major criteria which is explained by the NADA's is when you say the child has got cardiac problem, if there is a systolic murmur, these are the major criteria to say that child is having cardiac problem: systolic murmur, diastolic murmur, cyanosis, and congestive heart failure. What are the minor criteria to say that child is having cardiac problem? Presence of the systolic murmur, abnormal second heart sound, abnormal ECG, abnormal chest X-ray, and abnormal blood pressure. Now, presence of 1 major and 2 minor criteria will diagnose the congenital heart disease. Presence of 1 major and 2 minor criteria will diagnose the congenital heart disease. Now, talking about acyanotic congenital heart disease, the history is extremely important. Basically, the history is very, very important. The presence of the feeding difficulties. Child is having easy fatigability. Child is having exertional dyspnea and also repeated respiratory tract infections. So these are considered as some of the very common things that helps to identify the acyanotic congenital heart disease. Feeding difficulty, because see, cyanotic heart disease is also there, where the feeding difficulty is not a bigger problem there. Okay, feeding difficulty, suck, rest, suck cycle. So that is very common in acyanotic congenital heart disease, where there is the presence of a VST. Okay, so family history sometime may be seen, and especially the maternal disease like diabetes mellitus, SLE, phenylketonuria, and history of intake of the drugs during the pregnancy like antidepressants. So these are very important because these are all the major causes for acyanotic congenital heart disease. Acyanotic congenital heart disorders can be again divided into clinically obstructive and non-obstructive and miscellaneous types. In the first division we have seen with the increased blood flow, decreased blood flow, etc. That is one type of division. One more type of division for the clinical sense I am telling, because if you divide like this, it's very easy to diagnose a disease. Okay, for the clinical purpose it's quite easier. Acyanotic congenital heart disorders can be again divided into two types, either as obstructive type or non-obstructive type or miscellaneous, mixture of both. Now, what do you mean by obstructive type? In the obstructive type means there is some obstruction, as the name suggests. Okay, obstruction to the normal blood flow. Okay, for example, pulmonary stenosis. Now there is obstruction, so blood will go to block there. Okay, aortic stenosis, blood will be stagnated there. Then coarctation of aorta. Then peripheral pulmonary artery stenosis, congenital mitral stenosis, pulmonary venous stenosis. Everybody there is stenosis, etc. So there is a blockage for the normal flow of the blood. This is one type of a lesion. So this actually leads to a different set of symptoms. Another variety is non-obstructive type. In case of non-obstructive type, what happens is there is actually no obstruction, like idiopathic dilatation of the pulmonary artery. There is a dilatation. Because of the dilatation, blood is going to stagnate there. Okay, absence of the pulmonary valve, no obstruction at all, but the valve itself is absent, so blood flow is not regulated. So these are called as non-obstructive types. Miscellaneous types are also there. For example, congenital cardiomyopathies, dilatation of pulmonary artery, then absent pulmonary valve, and end myocardial fibroelastosis. So these are some of the conditions which mixed symptom types will be seen. Now, cyanotic congenital heart disease, another classification. Okay, another classification is see, we have seen different types of classifications, acyanotic heart disorders, because these classifications actually helps to identify the different types of the patients. Otherwise, it's very complex for the diagnosis also and also for the treatment. But once you go in this way, it is quite easier. Another classification is actually acyanotic disorders, simple left to right shunt cases. Cyanotic disorders are there, only shunt cases. And there is atrioventricular shunt, VSD is there, or ASD is there. Okay. Another is a shunt at atrial level. Only at the atrial level there is shunting. Common example is ASD. Shunt at ventricular level. Best example is VSD. Shunt at great artery level. Greater artery, bigger arteries. There is a shunt. That is patent ductus arteriosus, or AP window, or aorta ventricular tunnel syndrome, like this. Uncommon syndromes. So this is another type of classification of acyanotic heart disorders. Now, acyanotic congenital heart disorders, now we have to look into the history point. A child, to diagnose acyanotic heart disorders in the growing child, the maternal history is very important. Whether mother has got any maternal infections during the pregnancy, because rubella syndromes, congenital torch infection, cytomegalovirus, varicella virus, so there are most common causes of this type of acyanotic heart disorders. Now, maternal infections during the pregnancy, or any cardiac disease present history, and the mother is having some cardiac problems, etc. Symptoms of pulmonary venous congestion during the pregnancy, like dyspnea, orthopnea, paroxysmal nocturnal dyspnea, cardiac asthma, cough, and hemoptysis, etc. Symptoms of systemic venous congestion, symptoms of low cardiac output, chest pain, cyanosis, and jaundice during pregnancy, palpitation to the mother, symptoms of the peripheral vascular disease, and also toxic symptoms. So everything has to be identified in the history. So if you get this history and if you find any of these symptoms, that suggests that yes, child may have cardiac problems because of some other maternal factors. Rubella syndrome, we know that rubella syndrome is one of the most common syndrome. We have to be always careful. Congenital rubella syndrome. Cataract, this is characterized by cataract, microphthalmia, retinopathy, deafness, mental retardation, microcephaly, and cardiac anomalies. What are the most common cardiac anomalies? Like PDA, pulmonary stenosis, and VST, etc. So rubella. Okay. Thrombocytopenic purpura may be also there, and hemolytic anemias, hepatosplenomegaly will be also there. But for us, important is cardiac problems. So the extra cardiac markers of the congenital heart disease, like microcephaly, dysmorphism, hypertension, microcornea, microphthalmia, then brush-filled spots, pinched root of the nose, and low set and malformed ears, and upward pinching of the nose. So these are some of the extra cardiac markers of the heart disease. Why? Because there are so many symptomatic syndromic presentations are there. whenever we talk about syndrome, there will be multiple symptoms will be there. So along with the cardiac problems, there may be also symptoms of other systems also. Similarly, some of the other extra cardiac markers of the congenital heart disease is a long philtrum, inverted V-shaped upper lip, then pointed chin, small triangular face, and upward and downward slanting of the eyeball, etc. And the infection, there is a precordial projection, exavaction, and apical impulse, abnormal pulsations of the precordium, etc. Anyway, some of the common syndromes, we know the Down syndrome, Turner syndrome, and trisomies, sometimes monosomies. Then another common syndrome is Williams syndrome, where we get the Elfin faces, and Down syndrome, Holt-Oram syndrome. So these are some of the syndromes where we will have the cardiac problems. In all such conditions, along with the cardiac problems, we also get the symptoms of other systems also. So with this we conclude for this topic for today. The next class we will continue the same. Thank you very much.